Chemicals play an essential role in modern society by supporting industrial development, healthcare, agriculture, and daily life. However, when hazardous chemicals such as asbestos, benzene, and formaldehyde are not properly managed, they pose serious risks to human health, occupational safety, and the environment. In Malaysia, continued asbestos use exposes workers, particularly in construction and manufacturing, to severe diseases such as lung cancer and mesothelioma, making effective chemical management a national priority. At the same time, COVID-19 has introduced significant biological and ergonomic hazards in workplaces, especially in laboratories, healthcare, and industrial settings, where close contact and poor ventilation increases transmission risks. Prolonged PPE use, mental stress, and operational disruptions further affect workers' safety and productivity. Effective control requires strong enforcement of OSHA principles, including engineering controls, administrative measures, worker training, and emergency preparedness. The Occupational Safety and Health Department, supported by the Malaysian Chemical Management Division, plays a critical role in ensuring regulatory compliance, aligning with international standards. Through proactive chemical and pandemic risk management, Malaysia can protect its workforce, safeguard public health, and promote sustainable industrial growth. One of the main focus of chemical safety in Pharmaceutical Laboratory, including 1. OSHA Hazard Communication Standard, or HAZCOM. 2. Chemical Risk Assessment and Classification Safety Data Sheets, or SDS. 3. Management and Chemical Storage. 4. Personal Protective Equipment, PPE, and Engineering Controls. 5. Administrative Controls and Standards of Procedures, SOP. 6. Training and Competency. 7. Emergency Preparedness and Response. 8. Chemical Waste Management. 9. Health Surveillance and Occupational Health. 10. Maintenance, Inspection, and Validation. 11. Documentation and Record Keeping. And lastly, 12. Digitization and Technology. The hazard in pharmaceutical laboratory and hospitals includes chemical hazards, biological and infection hazard, physical hazard, environmental hazard, ergonomic and human factor hazard, and fire and explosion hazard. During the COVID-19 pandemic, chemical hazards became a major occupational concern due to the increased use of disinfectants and cleaning agents. Many commonly used products contain chemicals such as bleach and alcohols, which can cause skin, eye, and respiratory irritation if improperly handled. OSHA requires employers to address these risks through hazard assessments, proper labeling, access to safety data sheets, employee training, and the provision of appropriate PPE. Poor ventilation or improper chemical mixing can further increase exposure risks. In line with USEC Regulations 2000, employers must monitor exposure, maintain chemical registers, and conduct medical surveillance. Effective chemical management ensures worker safety while maintaining infection control in the workplace. The main regulation said includes Regulation 2 covers chemicals that are toxic, hazardous, or listed under scheduled substances, including pesticides and industrial chemicals. Regulation 5. Register of chemicals hazardous to health. Requires identification, documentation, and tracking of hazardous chemicals. Regulation 628. Sets ceiling limits, time-weighted averages, and maximum exposure limits. Regulation 26. Requires monitoring of employee exposure to hazardous chemicals. Regulation 27. requires medical surveillance for workers exposed to hazardous chemicals. Biological hazards involve infectious agents that cause disease, and for COVID-19, the primary hazard is the SARS-CoV-2 virus. This virus spreads through respiratory droplets and aerosols, especially in close contact workplaces, poorly ventilated indoor environments, and during aerosol-generating activities. OSHA emphasizes that occupational risk depends on factors such as job duties, ventilation, physical distancing, and community transmission levels. Transmission can occur through person-to-person contact, airborne particles in enclosed spaces, or contaminated surfaces. Therefore, workplaces must conduct proper risk assessments and implement effective control measures to reduce exposure and protect workers. OSHA classifies COVID-19 exposure risk into 4 levels: very high risk for aerosol-generating medical or laboratory procedures, high risk for healthcare workers in close contact with COVID-19 patients, medium risk for jobs involving frequent public interaction, such as retail or transportation, and lower risk for roles with minimal contact, including remote work. This classification helps employers select appropriate controls. OSHA recommends applying the hazard assessment, engineering controls like ventilation, administrative controls such as distancing and shift staggering, and PPE where necessary. Although there is no single COVID-19 regulation, OSHA enforces protections through the General Duty Clause and existing PPE and respiratory standards to reduce biological hazard exposure. Ergonomic and human factors, hazards arise when workplace conditions place excessive physical or cognitive strain on workers, increasing the risk of injuries, fatigue, and human error. In high-risk environments such as pharmaceutical manufacturing, chemical plants, and healthcare facilities, repetitive tasks, manual lifting, awkward postures, and prolonged standing can lead to musculoskeletal disorders and reduced alertness. During high-demand situations, fatigue, stress, inadequate training, and cognitive overload further increase the likelihood of errors when handling hazardous or sensitive materials. OSHA emphasizes controlling these risks through ergonomic design, mechanical lifting aids, job rotation, proper training, and workload management to reduce human error and prevent serious workplace incidents. In healthcare settings, oxygen therapy for COVID-19 patients creates oxygen-enriched environments that increase fire risk, as even normally low-risk materials ignite more easily. At the same time, frequent use of flammable disinfectants, such as alcohol-based sanitizers and peroxide products, can lead to chemical fire or explosion hazards if improperly stored, mixed, or handled. OSHA and NFPA guidance require proper ventilation, safe storage, labeling, segregation of incompatible chemicals, and staff training. In conclusion, professional codes of ethics play a critical role in guiding engineers working in pharmaceutical laboratory environments. By prioritizing public safety, health, and welfare, organizations such as the National of Professional Engineers, or NSPE, emphasizes that hazardous chemicals and infectious agents in the laboratory must be operated and handled responsibly and safely. Ethical obligations extend beyond technical design to include maintaining professional competence, reporting hazards transparently, and considering the long-term environmental and societal impacts of laboratory operations. Compliance with OSHA regulations and biosafety standards is not merely a legal requirement, but an ethical commitment to protect laboratory personnel, patients, the community, and the environment. Ultimately, ethical engineering practice strengthens trust, supports effective pandemic preparedness and response, and promotes sustainable pharmaceutical development for the future.